So my son did have his appointment with a vascular surgeon about getting a fistula. A fistula is a way they combine an artery and a vein together, and sometimes it's with a mesh, sometimes it's not, to access for dialysis instead of having a port in his chest. And there's some benefits to having that. One, the port is a great risk for infection because it's on the outside and it leads directly into his heart. So it is always at risk for infection. It's at risk for being dislodged. It's just not safe to have something that's on the outside directly leading into your heart that is easily accessed. It's just a high risk for infection, and we understand that. But a fistula is not always it does take a major artery, a major vein, and connect them together, and that arm can never be used again because of that fistula. And it also, because you have artificially connected an artery and a vein, it is a high risk for bleeding. It's a high risk for it blowing up. It's a high risk for a lot of different things, for blood clots. There's a lot of different things that can happen, so we understand those risks as well. I know that since I've been a nurse a long time, and my history with fistulas is not always the best. I think of I've seen some pretty bad things happen. But he said that when he spoke with the vascular surgeon that they talk now about these fistulas not being as big or as ugly or as invasive as they used to be, that they're able to actually make them much safer and smaller and more under the skin. He would have to be careful working out. If he worked out, it would cause the fistula to stick out more, so he would just have to accept that if he's going to continue to work out. And also, it's a high risk for bleeding, so the days he has dialysis, he might not be able to lift with it those days, so that takes 3 days a week that he couldn't lift with that arm. So, and also, it would run a little bit of a risk at playing golf because he does have a big, powerful swing on, and he's a right-handed golfer, and that's his right arm that would be accessed. So, those are the issues with the fistula we face. But again, like I said in the previous video, that is on hold right now until we find out more about his transplant.